How's it going, everybody? Welcome to the Art of Healing with your hosts, Dr. Judy Jasek of Animal Healing Arts and Matt Rowe of ParsleyPet. During our show, we are talking about your pet's health, raw feeding, and alternative treatments for cancer, unexplained illnesses, and supporting your pet's natural ability to heal. Welcome, Dr. Judy, to this week's show.
Thanks, Matt. Happy to be here.
This is going to be a good one. So we are talking about today, why is my dog's tummy upset? So we're going to be talking about irritable bowel disease and irritable bowel syndrome, IBS, and inflammatory bowel disease, IBD. So what got you curious about this, and what drove you to bring this up as a topic, Dr. Judy?
Well, we see a lot of gut issues in pets, first of all. The vomiting, probably more so abnormalities in the stools, loose stools, sometimes constipation, but mostly loose stools, intermittent vomiting, spitting up, things like that. So it's very, very common. I think actually a lot of it is diet related. But another reason it comes up in the profession is people will go in, like before I see them, they'll go into more conventional practitioner and they'll do all this testing, and sometimes they'll even get a biopsy, and then an intestinal biopsy, which is a pretty invasive procedure. It requires general anesthesia and everything, and they'll get this biopsy done, and then they'll come back with this diagnosis that's IBS or IBD. And it'd be like, okay, that really doesn't even tell us anything. So there's such common terms in veterinary medicine, but as far as telling you what's going on with the dog or how to fix it, it really tells you nothing. And I like to bring this to the forefront because I see people spend a lot of money getting this diagnosis that doesn't mean anything at all, really. It doesn't help us treat the pet. So, if a pet has diarrhea, the gut's inflamed. You don't have to pay $2,000 to get a biopsy done to say, yeah, we have an inflamed gut. Now that biopsy can rule out things like cancer, which are a little bit more serious, but most of the time we get this IBS, IBD diagnosis, and it doesn't even change the treatment plan on the conventional side, because they usually do suppressive medicine. They put the pets on steroids or some sort of even stronger immunosuppressive drug to reduce the inflammation, but they're not even getting close to, touching on the underlying cause, which in probably 90% of the cases is diet. We've talked about, the importance of not feeding kibble and feeding fresh food diets. And a lot of times these pets, you get them off of an inflammatory kibble type diet or other type of diet that's high in carb and processed, and they'll do a lot better. And, we can work to heal the gut and heal the microbiome and get the symptoms to resolve without having to do these heavy duty drugs. And I think what's just important for people to realize is this is not a definitive diagnosis. Conventional medicine likes to put a name to things. Once they give it a name, then there's a treatment protocol for that name, but they're not treating the pet. And that's what I say. People say, how do you treat such and such? I'm like, I don't treat diagnoses. I treat pets. So I look at the whole picture and what's going on with the pet and what we can do to help the pet. And that just gets so overlooked, I think, in conventional medicine.
So they're really looking at more of the symptom side of it. So as they go and take a look at it, they want to treat the symptom to alleviate the pain from the dog or whatever's happening that's getting the pet parent to go in and take their pet in for an upset tummy, IBS, IBD. So they're treating that symptom, but they're not really getting to the root cause of what may have caused or what is continuing to aggravate the IBS and IBD.
Right. And sadly, when you put a pet on immunosuppressive drugs, yeah, you might get those symptoms to go away, but then you're going to end up with more disease later because you're suppressing the immune system. You're
Right.
not addressing where did this inflammation come from in the
Mhm.
first place. So we're still going to have an unhealthy microbiome. And these are the types of pets I actually see, they end up coming in with cancer or some autoimmune
Mhm.
disease or something more serious
Yeah.
on down the road because the body is just not being supported.
Well, isn't inflammation happening because there's something in there that the body is not agreeing with? So,
Right.
for example, if I ingest a chemical by accident, my body's going to inflame up, my immune system's going to go crazy because it's trying to get whatever I just ingested out. So, for example, if I eat Taco Bell, my body is going to try to reject the Taco Bell and flame up. My stomach's going to get upset. And until it gets out of my system, my body is going to try to help me every way it can. And the way it does it is inflammation. So if my dog's belly is becoming inflamed because of what it's eating, but I never address that it's the food that might be causing this or another external toxin, then ultimately I'm just deflecting what the body's natural ability is to heal that toxin that's in the system to get it out, which is the inflammation.
Right.
So in
Right.
case, so if I take an immunosuppressant, I'm really just masking what might actually be happening and what might be causing this situation.
Right. And that's what conventional medicine does. Really, it treats symptoms. Just make the symptom go away. And I think it's really important for people to realize to achieve true healing, it
Mhm.
takes some time. If you're going to change a diet
Yeah.
and heal the gut, that doesn't happen overnight. You can
Right.
alleviate those symptoms in a few days, but you're
Mhm.
not treating anything. And ultimately, again, the pet is going to get worse. And
Mhm.
conventional medicine is great at treating symptoms, but it does nothing to create ongoing health. And
Yeah.
that's what more holistic medicine does, and changing the diet. And sometimes you've got to try a couple different diets and
Mhm.
different things, and maybe some different herbal support or other things that will help
Mhm.
support the gut and help the gut to heal, because every pet is different. And that's why I really dislike this, one size fits all. Well, we have this diagnosis, and so let's suppress the symptoms with these drugs. Every pet is different. So there is no one size fits all. There's no,
Right.
this is what I use to treat this condition. It's like, no, I treat the pet. And every time
Yeah.
I see a client, I will say, this is a starting point. Whatever we're going to
Mhm.
do, we're going to start with this based
Mhm.
on my experience. These are some things that would likely help, but then ultimately we need to look at the pet and how is the pet responding, and is
Yeah.
this, as what we're doing, improving the health of the pet.
Yeah. That's crazy to me that, if the stomach is inflamed there, the bowel is really getting inflamed at that point, and it's an inflamed bowel that's sitting in and it's causing the pain your dog has. So the only thing that can actually get to my bowels is stuff that I put into my mouth.
Mm-hmm.
And so now, without addressing the cause or what I'm putting in my mouth and just treating the overall inflammation of the symptoms, doesn't mean that what I'm eating isn't going to continue to cause inflammation or issues inside the gut. It's going to continue to perpetuate that and continue to have me be on immunosuppressants, steroids, or whatever other protocol that the doctors gave me at that point. If I never stopping what's causing it, then it's just a continual, for the rest of my life, I'm going to have to take this medication in order to get my stomach to feel, or your dog's stomach to feel better.
Right, exactly. And the disease, like you said, the inflammation goes on, and the pet actually gets sicker and sicker and sicker. And then usually, like I said, some other disease shows up on down the road, autoimmune or
Mhm.
cancer or something else. And you can never take them off of that medication, or the symptoms will come back.
Right. So what have you found? So in your protocol, when you go after treating the dog, the whole health of the animal, what kind of things have you found that help a dog that might be experiencing IBD or IBS, that really kind of gets them to start getting off of the conventional medicine if they are on that?
Yeah, well, the first thing is you have to eliminate what may be causing the inflammation in the first place. And like you just said, whatever is inflaming the gut is likely what the dog's eating. So we want to get them, off of kibble diets, because kibble is very inflammatory. We've talked about that quite a bit on the show.
I think every show we talk
I
about
think
it.
well, yeah, because it enters into everything. Like it's bad. It's bad stuff.
Right.
So fresh food diet, bottom line, get off the kibble, get off all the processed carbs, get them on a fresh food diet. And a lot of times, I would do that as a first step. And it may not pull them off the medications quite yet, because when you start to pull them off those medications and they're still on this inflammatory diet, they can get really sick.
Yeah.
So we'll do the diet transition, and then usually the immunosuppressive drugs, we have to wean them off anyway. So we'll get the dog, going with this transition, and then start to wean them off the meds. And then we see where we're at. Sometimes that's enough. Sometimes that's all they need is a diet change. Get them off the inflammatory kibble, get them on a fresh food diet. And sometimes that's the end of the story, especially in a young dog. Dogs, that are older, as it's been going on longer, we might need to give additional support. So there's herbal support. Slippery elm is a great, just very soothing herb for the gut. If we have diarrhea, it helps the gut heal, helps calm down that inflammation. Sometimes we need to treat leaky gut because the gut's so inflamed that the spaces in between the cells are bigger, wider than they should be. And we're getting molecules into the bloodstream that are way bigger than they should be. And the pet will react to that. And that's why sometimes this can also be related to skin disease and itchy skin too. And the issue is we need to heal the gut rather than suppressing the symptoms in the skin. It's all related. So simple herbs like that. I work with Chinese herbal formulas. Sometimes something like that to help balance the body can have a great effect. Pre and probiotics are sometimes appropriate. There's a lot of individual variability there, when it comes to things like probiotics. So we know we want to support the microbiome. We want to support the healthy bacterial flora in the gut, but there are thousands of different species of bacteria growing in the gut, and any given probiotic is going to have maybe 5 or 6. So you're going to throw those in there. Are those the ones that particular individual needs? We really don't know, and until we try it. And the other thing is those bacteria need to travel through the whole digestive tract to the colon, which is where they are meant to colonize. And depending on the product, are those bacteria going to survive going down there? There are some spore-based probiotics that the bacteria are actually in the spore form. And so their survivability is supposed to be much greater. But again, are those the bacteria that particular individual needs? I think that where we really need to be focusing is, what are we feeding the bacteria? Because it's like a garden. If you fertilize your garden and you give the garden the right nutrients, you can grow nice, healthy plants. If you don't give the garden the right food, you're going to get a bunch of weeds. And that's kind of what happens in the gut. If we give the bacteria the right food for feeding the bacteria that we want to grow, those populations are going to grow. I don't think we necessarily have to be continually putting them in the gut. And even if we are giving a probiotic, which we're actually putting the bacteria in the gut and we're not feeding them appropriately, they're going to die. They're not going to survive. So the diversity in the diet, the rotation of different types of whole foods, and maybe even just a little bit of vegetable fiber to feed some different bacteria. I'm not a real big proponent of using produce to balance the diet nutritionally, but from what I've been learning lately about the microbiome, adding in that little bit of vegetable fiber and some of those phytonutrients will actually feed some of these bacteria. You think about what dogs do naturally. They're scavengers. They got their noses down. They're nibbling on all kinds of stuff.
Right.
And when they're domesticated, though, we eliminate a lot of that
Yeah.
type of thing. So adding in, I think maybe a little bit of plant material, and this doesn't have to be, a lot, just enough to get these populations going. And then once they get going, then the healthy bacteria are going to outgrow any of the bacteria that can cause disease and cause problems for the gut. And the gut's going to rebalance itself that way.
Yeah.
The body knows what to do. I mean, that's what's so amazing about healing in this approach to medicine. The body knows what to do. And I think most of the time humans just need to get out of the way, because we're doing more harm than good by thinking, you know what, we're smart, we got all this figured out. And I think not so much. I think we need to get out of the way, quit insulting the body, quit putting toxins in, quit over vaccinating, quit giving these inflammatory toxic foods. And in a lot of cases, the pet's body is going to go ahead and heal. It knows what to do. And then we can add in some gentle support as needed. But the gut is so important. I mean, they're, continue learning more and more about this in both people and pets. And, if you don't have a healthy gut, you are not going to be healthy. It affects so many things. I was actually listening to a podcast the other day that said that, if you're stressed, just stress, and I think stress is important for our pets too. When people get stressed, your pets get stressed, and just stress will change our microbiome and change your pet's microbiome. And then you actually grow bacteria that perpetuate the stress. So the bacteria actually release substances that keep you in fight or flight, that make it harder for you to relax, and that perpetuate the anxiety. So it's like, it's almost like we're just this little house for all these bacteria, because we're really mostly bacteria. There's way more genetic bacteria in our microbiomes. And we have bacteria all over our body. We're talking about the gut today, but there's bacteria on the skin and the respiratory tract and all over. And there's way more genetic material in that bacteria than there is in all the rest of the cells in our body. So keeping these bacterial populations healthy and growing the healthy bacteria is probably the most important thing for our health and for our pets' health.
Yeah, I've read where the good bacteria in our body outnumbers our cells 100 to 1.
Yeah.
So really, philosophically, we're just bacteria.
We really are.
Bacteria. And when you look at your gut actually has more neurons firing than your brain does. So it's been attributed as your gut is your second brain. Think of, I have a gut feel. All of that stuff. And so really that's what's feeding our brain going up. So if we're putting toxins inside of our gut and it's inflaming and it's becoming irritated and all these moments, that is a direct correlation. It'll move up to our brain and it'll start affecting our mood. It'll start affecting how tired we are, our activity. And so you're seeing all these other issues. Maybe it's the reason why you went into the vet in the first place. You noticed your dog was more lethargic, sleepier, diarrhea, like things just were off, and you knew they were off because you know your dog so well. And so in that moment, we take them in and they treat the symptom, irritable bowel, but it never got to the root cause of what happened to it. So and you talked about too, is feeding that gut bacteria. And so it's something I do with Leo is I give him, he'll get 2 tablespoons of pumpkin in the morning. And it's really creating, and it's on that idea of that fiber and that prebiotic to help seed and create that base for the colon to actually be able to grow this good bacteria that Leo and Mr. Chacha are going to benefit so much from.
Right. Super important. I think diversity, lots of variety. For our pets, I still think that a primarily meat-based diet is the healthiest thing, but then, some little additions here and there that are going to help, feed that healthy microbiome, I think is really important.
Yeah. You make a good point. If a dog is wild, they're not just eating the animal they killed, they're eating the dirt. I mean, you talk to like
Right.
Billy Oakham over at Answers Pet Food or something like that. He actually gets dirt from his farmer that is from a clean, organic, biodiverse soil because of the good bacteria that's in that soil. And he goes, well, that's what my dog would eat. If it's not like he has a plate, he put the animal on, and so he keeps it clean and has the tablecloth laid out so that he doesn't get anything in there. No, he's eating the dirt as well when he eats the animal. And
Well,
so he eats grass, and yeah.
well, think about what happens if a dog like ran out and killed a rabbit. That
Mhm.
rabbit is all covered in dirt when that dog starts
Yeah.
to eat it. So they're automatically getting those, the microbes from
Mhm.
the soil.
Mhm.
Unfortunately, a lot of our soils these days are not healthy, but out in the wild, a healthy, like you said, biodiverse, organic soil, they're getting a big dose of that. And
Yeah.
we're missing that. I think we're trying really hard to figure out what's the best diet for our pets, but I still see things like chronic skin disease and chronic gut issues that
Right.
in some individuals can be really, really challenging to clear up. And I think it all comes down to the gut health and to a healthy microbiome. The key is, and the tricky part is figuring out what does each individual need. And they're all
Mhm.
different. This is individual genetics. It's
Mhm.
not, again, it's even like with the probiotics and all these things that we're talking about, it's not a one size fits all. You have to jump in, try some things, see how
Mhm.
that works for your pet. That doesn't work. You have to be willing to try some other things
Mhm.
and figure it out. And you have to have some patience because true healing takes time. It's
It
not,
does.
it's not a here's the pill and the symptoms are going to go away. You want that approach, then you're never going to have a healthy pet.
Yeah, you're always going to be chasing it to some degree. But the first step with all of it is a raw-based diet, is getting off of kibble and then start experimenting with those little things that Dr. Judy and I talked about within, some vegetable matter. But really, I know for Leo, he can't do spinach, but he can do
Hmm.
pumpkin without itching. So it doesn't inflame him up, but it's just all an experiment. But I started with a raw diet and got everything kind of
Mm-hmm.
back to baseline. Then I was able to start experimenting on what Leo specifically needed in his diet.
Right. And even a little bit of kibble will continue to do the damage. So I'll often hear this, well, I feed raw, but I'm trying to get down on cost. So I still give, a little bit of kibble, even a little bit. If it's something inflammatory, like I myself, I am sensitive to gluten. I don't have to go eat, half a loaf of bread to react to gluten. If I have a cracker or there's a little
Yeah,
gluten, I go out to eat and there's a little gluten in the salad dressing, I will
right.
not feel good afterwards. And it takes
Mhm.
time for that inflammation to come back down. So even a little bit of these inflammatory foods will keep this process going and you're not going to have good results.
Yeah, that is a great point to make. So thank you, Dr. Judy, for going through all of these points and discussing IBS and IBD with everybody out there. This is very, very important. So if an individual wants to have a conversation with you, what is the best way for them to get a hold of you?
Well, my website is ahavet.com. So Animal Healing Arts is my practice. My email is info@ahavet.com. And my phone number is 720-515-2421.
Awesome. And I highly recommend engage with Dr. Judy, have a telemedicine conducted. If you're not living in Denver, you can definitely go see her directly. But if not, go have schedule a telemedicine with her. So she can actually see on Zoom, kind of like how this is happening now, she can see your pet and have a conversation with you about if your dog has IBS or IBD, something on some of those treatment sides of it and getting support along that journey. So thank you very much, Dr. Judy. And if you ever want to reach out to us, we are ParsleyPet.com. And what we talked about was how do you dial in that diet to make sure that they're meeting their nutritional requirements. You can have a test conducted, which will test the minerals and nutrients inside of your dog and how they're actually absorbing their food and seeing if it's the right one for them. So you can come to ParsleyPet.com, order yourself a nutritional blueprint, and know and find out if you're doing it the right way. So thank you, Dr. Judy, for having the show with me today. This has been awesome.
Yeah, thanks, Matt. It's always a pleasure to be here and help people get educated. There's so much to learn out there and so much confusing information. So hopefully we're able to help people sort through it a little bit.
Yeah, the more we can do this, the better. And this is stuff that we're both passionate about. So thank you again.
You're welcome.
All right, we'll see you guys later.
Bye, everybody.